Rifkin, and we're just going to have a little chat.
Why not?
So tell me,
What should we talk about?
let's talk about some of your work, what you do.
What I do? Okay. Well, actually, I am a reconstructive and cosmetic dentist in Beverly Hills, almost at 50 years right now. And I love these kinds of events where I can support, as I do, all the military and veterans and active duty people. This is Armed Forces Day, right?
Yeah.
Okay, so it's a day we're going to celebrate all that. But I'm here to support. I'm part of a group with called RAW, R-A-W, which means Rebuilding America's Warriors. I'm one of the medical directors for the last 10, 15 years, I think, maybe more. And what I do, along with many other doctors and nurses and volunteers who are really wonderful, they donate their time and money and effort to help injured veterans, injured military personnel, beyond what the military can do for them. So cosmetic surgeons or plastic surgeons, reconstructive surgeons, all kinds of people that help these heroes get better and rebuild their lives in other ways. But we can do that anatomically. We hope that their self-esteem, their confidence, their entry back into normal life, non-military life is better because of what we could do in our efforts, our small ways. You know, they're the real heroes.
That is absolutely fabulous. So, as the medical director, you're a leader in the organization. Tell me about the people that you lead.
Okay, well, first of all, I'm just one of the medical directors in mostly the dental aspect. There are physicians, and the main leader is Maggie Lockridge, and she's incredible. She's a nurse. I believe she was formerly an Air Force military nurse, and then she was in plastic surgery afterwards. And I think she had a great fondness for our military personnel. And with her and another plastic surgeon, who's not with us anymore, Dr. Norman Leaf, who's an amazing person, a good friend of mine, they were looking for a dentist, somebody that could handle some of the facial problems and injuries, and they asked me, and I said, absolutely, I'm in. So why not?
You know, you just brought up a good point.
Sure.
Their injuries are horrific.
Yes.
Tell me about the impact that you have on these people and their self-esteem and how it makes them feel.
Well, I don't want to oversell myself. A lot of people are involved to do this, but the impact on even my patients that have not been injured, being able to communicate, smile, and look in the mirror and feel good about yourself is hugely important to make you feel positive. You don't have to feel like you have to hide in a corner when you've had a terrific, horrific injury that you try as a doctor to bring them back to normalcy, and sometimes you're limited. Their recovery is not only anatomical, but I think that experience in life really is inspirational to we who have not suffered such an injury. They seem to be positive despite the fact that they still carry around a scar or a memory of something that was tragic to them and horrific. But I think they almost become, I don't want to say better people, but I think they become inspirational to us that you don't always have to look perfect, but not having your ability to communicate verbally, visually, or smile with some confidence, it's a problem. So when we can restore that, it's quite a blessing for them, and it's certainly heartwarming and a blessing for us.
Let me ask you a question, sir. If there's a lot of viewers out here,
Okay.
and if there were a message that you could give to everybody, I mean, an impactful message about the organization,
Yes.
what would that be?
Well, the organization reaches out to as many of these veterans and injured heroes. We need money, as all charities do, because just to transport people, to get consultations, you know, the doctors and nurses, they don't get a cent. We don't want anything. It's all gratis. But there are some additional costs for housing, for transportation, taking care of these people. So donate where you can. You know, it's.
So what you're saying is, you and all of your fellows that you work with
Sure.
are all volunteers.
All volunteers.
All volunteers.
Absolutely.
So you guys are doing it for free.
Yeah.
Wouldn't it be nice if you out there, if you can,
Yeah.
to donate to this organization? Because even though they're donating their time, which when you donate time, you can never get time back. Time is a powerful and valuable asset. if you could just donate something to help keep this organization going. Because imagine, these are warriors who have been wounded and horribly wounded, and this is a way that they can heal and help heal them. And anything that you could, no donation too small, correct?
No donation too small. I'm not here to procure money, but you asked me the question.
That's right.
And no, there's no donation too small. I mean, if it's $2, everything helps. $2 times 100,000 people is $200,000.
Exactly.
That means a lot, okay?
Right. And you're right. I brought it up because I love the work that you do,
Right.
and I was wondering, like, how would they fund it?
Yeah.
And so it's by donations.
Yes.
It's
Yes.
by donations.
Yeah,
So
I mean, the military does what they can. The government pays for the military, of course, care, but there's a limitation to what military doctors can do with the types of systems that they have. And when it comes down to the finishing touches, I'll say that way, higher end reconstructive procedures, dental procedures, facial plastic procedures, burn scar revision procedures, all of these things take a lot of time and multiple surgeries sometimes. And when someone is deployed or discharged from the military, if they're in for 2 or 4 years, they can't go on and have 10 more surgeries if they need it. So that's where we come into play and try to help, and do help, but it does cost money. We don't want any of the money. We just want these heroes to be helped. And
let me ask a question.
Sure.
Because you're just giving me all this information.
Yeah.
Someone comes in, and I don't know if you have an answer for this, but how many doctors would you say might be involved in one patient?
Depends on the injury. Of course, there's orthopedic surgeons for people that have broken legs, lost limbs. There's dermatology doctors that for scar revisions, burned, severely burned scars, patients that, or military that have been burnt because of bombs, because of fires. There's obviously plastic surgeons to reproduce tissues. There's dentists that replace missing teeth or broken jaws. I mean, all of these doctors, there's probably ophthalmologists to replace or fix eyes or eyelids. All the injuries that you can imagine from military tragedies, from automobile accidents, from firemen and fire personnel going through